From WFRB TV Local 5, your local election headquarters, this is Newsmaker Sunday with your host, Tom Zalaski.
And welcome, good morning to Newsmaker Sunday. I'm Tom Zalaski. Wisconsin faces a growing shortage of psychiatrists and access to mental health services. Statistics, they are startling. 49% of residents with a mental illness do not receive care. 76% of Wisconsin counties face a significant shortage of psychiatrists, 20 counties having no psychiatrists at all. And those seeking help range from kids to adults. Well, joining us this morning, Dr. John Schneider, who will soon be president of the Wisconsin Psychiatric Association. Dr. Schneider, thanks so much for joining us this morning.
Thank you for having me.
How bad overall is this problem in the state of Wisconsin?
It's a large problem. It's quite challenging.
You say there are some counties in Wisconsin right now that don't have a qualified psychiatrist. Now,
Correct.
You're in Milwaukee County. Some counties don't. How did that happen? Why isn't there just even one psychiatrist in a county?
For one reason, reimbursement has been really low for psychiatry for years. Lots of new graduates have gone into higher paid specialties. As a result, it's created less people going into the profession. Most psychiatrists, probably 50 to 55% of psychiatrists, are over the age of 50, so they're going to retire soon. And a lot of them are at late career, so they're not working as many hours as mid-career or early career psychiatrists. So those things together, in addition to increasing rates of people seeking care, historically there have been lots of stigma and reasons why people don't seek care. National organizations, states, government, people in general have worked very hard at making care more accessible, and as more people have sought care, there's still a large gap. Don't misconstrue that there isn't, but more and more people are seeking care. So those factors collectively together make the mismatch between the need and the supply of people that can provide the care.
For someone who needs help, how long of a wait would there be right now?
Depends on the area. If you're in a more urban area, anywhere from 2 weeks to get a therapy appointment to see a psychiatrist. It can be anywhere from a month to a couple of months. In a more rural area, particularly north central, northwest, could be 3-4 months, depending. Child psychiatrists are probably the shortest and hardest. So if you have particularly younger kids, it can take 6 months or more.
And when you say a month or 2 months, oftentimes that's too long. I mean, the person needs the help right now.
Correct, depending on the problem.
And you say it's a bigger issue with kids.
Correct.
You have fewer psychiatrists dealing with kids.
Correct.
Why is that?
It's a subspecialty training. So to be a psychiatrist, you go to medical school for 4 years, and then you have 4 years of additional what's called residency training. To be a child and adolescent psychiatrist, you do an additional fellowship to learn that. So in total, a child and adolescent psychiatrist does 4 years of school and anywhere from 6 to 8 years of residency and fellowship after their medical school training.
So you're in the league with MDs.
Well, we are MDs.
This is not a 2-year school. You've got 8 years under your belt.
All of us are licensed as physicians. We have all completed medical school.
Now, there are counselors as far as the kids go. There are counselors in our schools in the state, but do we have enough in the schools?
I don't know specific numbers. Okay. Those are run more by the Department of Education and how people set up school counselors. Those are more based on screening behavioral needs in school, things like issues like that. They don't really address treatment of illness or developmental problems the same way that a medical professional does.
Mm-hmm. So for a parent watching right now, if they think their child is having some sort of an issue, what can they do? What steps can they take?
Go to their primary care physician. Go to the pediatrician, go to the primary care physician. Wisconsin started a program a number of years ago. The Department of Health Services put out a request for grants, and the grant was given to the Medical College of Wisconsin. They created a consultation line where any primary care physician or even adult psychiatrist can contact the child and adolescent consultation line so that they can get advice from a subspecialist on how to manage those kids, even though they can't get them an appointment with one timely. So there's a way for other doctors to get help to be able to care for them faster to make up for the lack of available professionals.
And then in some cases, if you don't have a place to go, then these people wind up in the emergency rooms.
So for lots of illnesses, lots of people end up in the emergency room.
Yeah.
So in some cases, an emergency crisis, whether it's through crisis services through the county Department of Health and Human Services, or whether it's through an emergency department, in some cases is the appropriate first pace to get started in treatment if you're in fact having a crisis.
All right, we continue on with Dr. John Schneider right after this, so please stay with us.